Good morning to all of you. As you heard, I'm Roberto Ferrari, and allowed me to thank Dr. Faridi, Dr. Habib, and Dr. Hani Nayan. It's really a pleasure for me to be here. And actually, I was thinking yesterday when I came out from the plane that Saudi Arabia now is my second country. I feel really at home. I've been here so many times in this very room. I think it was 3 years ago, and then we went to Opuf and so on. And it's really a big pleasure to be here with you and to share with you, together with my president, who allowed me to say hello to him. Hello, Fausto. He is traveling really immensely, and I have no difficulties that he will ask from which bed he's waking up every morning. But I know that I wake up in Daman. At least that was pretty sure. It's a big pleasure to be here, and the first session is to update you about what new has come out from our ESC Congress in London. And I will address the topic of arrhythmias. And this year there were some news about both atrial fibrillation and devices. From atrial fibrillation, we had three major messages. The first one relates to the importance of atrial fibrillation therapy and how we can try to make our patients to stay in sinus rhythm. And this is because in London has been released the 5 years results of the Mantra PF study. And this study looked at 300 patients with new paroxysmal atrial fibrillation, which were randomized either to ablation or to antiarrhythmic drugs. And they've been followed up for 5 years. And the results after 5 years was that those who receive an ablations had a significantly less burden of atrial fibrillation. In other words, they remain more and significantly more in sinus rhythm. This is an important confirmation that in this particular type of patients, ablation is superior to antiarrhythmic therapy. So a rather important message, and a message that we were awaiting for a long time. Then there were also some data on lifestyle, and lifestyles may be important for atrial fibrillation. And this is because in a group of patients who were obese, and they were treated either by antiarrhythmic drugs or by atrial fibrillation, well, then in these patients, they were convinced to reduce weight and or to improve fitness, let's put in this way, and the reduction of weight was of 2 METs. And then they were compared with those who remain with the same level of fitness for the 4 years. And again, it was quite clear that those who managed to have a better lifestyle and to reduce their weight, there was less atrial fibrillation when compared with those who didn't. And also, the study provided some evidence that some multivariate evidence or predictors of atrial fibrillation recurrence. And of course, as you can see, diabetes is one of these predictors, but also, very importantly, no changes in weight is another predictor of recurrence of atrial fibrillation, and also no gain or no improvement is another predictor of recurrence of atrial fibrillation. So the overall message is that if some of your patients has atrial fibrillation and is overweight, it is very important to try to convince him to lose as much as possible the weight and to try to join a better lifestyle. This is quite an important message because ablation is superior of antiarrhythmic drugs to maintain sinus rhythm when given at the first treatment. The success of atrial fibrillation therapy depends on lifestyle, which is important because it doesn't matter whatever you do to your patients. If they continue to have a bad lifestyle, you will not do very well, and the lifestyle modification should be part of the atrial fibrillation therapy. Then there were some data relating to the use of the newer anticoagulants, and particularly of rivaroxaban in the real life. And this is the results of the Xanthus observational trial. These are the first observational data obtained with the rivaroxaban. The aim was to assess its safety in unselected patients with non-valvular atrial fibrillation. The study was conducted for 1 year, so is a long-term follow-up, and the primary outcome was major bleeding, death, and occurrence of stroke. And as you can see here, there were very few events in this group of patients followed for 1 year. So the conclusion was that this is the first and large prospective study describing the use of rivaroxaban in a broad non-valvular atrial fibrillation patient population. The results are quite encouraging because the rates of stroke and of major bleeding with the rivaroxabans are low in routine clinical practice. Definitely, where that the CHAD score of these patients was 2, while that in the previous studies was 3.1. So somehow this observational study has targeted patients at lower risk. Then there was something on leadless pacing. This, as you know, is a new revolutionary technology which might allow us in the future to implant pacemaker without any leads. It was a study looking at the 6-month safety and efficacy on 300 patients who had this lead-free device, and the study was looking at a serious adverse event. The results are quite encouraging, but not completely, at least from my judgment, encouraging, because as you can see, the implantation success rate was quite high, and also the freedom from side effect was high, but still there were 7% of the patients who had complications. And this 7% is too much when you compare with the complication when you insert just a normal pacemaker. The pacing performance was good, and the longevity of the battery was about 15 years. So, as you can see, the leadless pacing is promising for patients who have the indication. The results are open up for future possibility of more pacing models and a combination with the usual one. But still, we need to do other studies. Then there was something related to device and the environment. And as you know, and particularly in this country, as so many people using portable phone and so on, there was for many years the idea that this could be damaging. It could be damaging for our brain, but also for the devices that we might have or patients might have implanted. And there was the possibility that all the electromagnetic fields could really influence either a CRT or pacemaker and whatsoever. The results has been quite reassuring because it is not really, there are no real concern, just some suggestion to keep the cellular phone, if possible, at a 15 centimeter distance from the device and the earphones at 3 centimeter distance, but really nothing very serious at all. Finally, there was an interesting study, again an observational trial conducted in France, comparing the CRT pacing or CRT-D. And the aim of the study was whether the CRT pacing should or would benefit from concomitant ICD, and the methodology used was analyzing causes of death in CRT and CRT-D patients with regard to if they were sudden, non-sudden, cardiovascular or non-cardiovascular type of death. And 535 patients which had been implanted with the CRT pacing were compared to 1,200 patients which were implanted with the CRT-D by French doctors, and they were followed for 4 years. You can see that patients will not really die of sudden death, but more of heart failure death or non-other cause death. So that is quite an important message to keep in mind. And then eventually there was a large observational registry conducted by the ESC, by our URP group, looking at lead extraction. And the question was whether the lead extraction is safe or not. This is the results of 12 months results, and you can see that the lead extraction indeed is safe with a low 12 months mortality of 6.7%. But what was quite amazing is that results from this registry is that after 1 year, about 1/5 of the Electra patients, Electra is the name of the registry, were never reimplanted. This was really quite shocking news, and is questioning whether and for which reasons the implant was made in the first issue. It is fair to say that this data are being obtained after 30 days from the lead extraction. Maybe that these patients will be reimplanted later on, but still lead extraction is not only a need, but also a chance to reconsider indication for device therapy. And with this, I think I have told you all what was said importantly about arrhythmias in London. Of course, there were millions of other paper, data, abstract, and so on, but this is what we think are the important messages. Thank you very much for your attention. Thank you.